Before we get started, please remember this podcast is for general educational purposes only. We're not providing medical advice, diagnosis, or treatment. Always consult your own healthcare provider about your care. Welcome to Fertility Nurses Unfiltered. 2 nurses, 1 mic, no bullshit. I'm Ashlee LaRue, fertility nurse and founder of Fertilities.
And I'm Laura Wepler, fertility nurse and founder of Navigating Fertility with Laura.
You got questions, the internet has a lot of opinions, but what you really need is 2 fertility nurses who aren't afraid to tell the truth.
No scripts, no sugarcoating, just honest, evidence-based nurse-to-nurse conversation. So let's get into it. Hey everyone, welcome back to Fertility Nurses Unfiltered. This week we are talking on a little bit more of a difficult topic. I think we've had some difficult conversations over the last couple weeks. This conversation is going to be one of those. I think we try to inject a little bit of lightheartedness at times, but today is really going to be talking about the calls that we don't like to receive, or as nurses that we don't like to deliver during fertility treatments, whether that's a canceled cycle, whether that is, a negative pregnancy test. There's so many difficult parts of the fertility journey. And so the focus of today's call is really talking about when cycles might get canceled, and how you might be dealing with that.
Yeah, I think this is a theme that Laura and I keep saying, I think on every single episode is we want to talk about the things that aren't talked about enough. We want to have conversations that, might be a little hard, but we also just want to bring light to things that do happen in the fertility community. So our clients, our patients, you out there, aren't necessarily shocked by certain things, or you weren't expecting certain things, that was even an option that something could happen. Kind of like Laura said, like cyst at suppression check, fluid in your uterine lining during a transfer. Maybe your embryo didn't thaw for a transfer. Those really hard, difficult calls that we have to make, they do happen in the space. And I think setting that expectation, you all deserve that expectation setting. You should know that, hey, it's not all, rainbows and flowers all the time. And I think a lot of us know that. But I think we need to normalize talking about it. I think we need to normalize that this isn't going to make things easier. It's not going to make those conversations easier or more fun to get or to make as nurses or clinicians. But I do think the more that we talk about it and we bring it up, it's like this is part of it, unfortunately. And no one wants to have these conversations, and no one wants to get these phone calls and conversations. But I think sometimes it's important to talk about the hard stuff.
Yeah. I think, and calling out, sometimes these conversations are happening in places that are difficult, right? You may not know when that phone call is going to come through. So maybe you're waiting for an update on your ultrasound and lab work to start an IVF cycle. And you're out, but you're going about still your day, you're at work, or maybe you're out and about at the grocery store, and suddenly your phone rings and you get a call with news that you weren't expecting. I think that happens more often than not. So I think it's important to talk about that as well. And I also think it's important here to also mention that I think, and this is a trend that we've talked about over the last couple of weeks, but we're seeing more and more communication coming through email or portals rather than through a direct phone call, or maybe, you're getting a phone call from the nurse or from the embryology lab, and now you have questions for the doctor and you're not having access to the doctor to ask those questions. And that can also be really difficult. And I think that's very clinic dependent on how you're receiving that information.
Yeah, no, I think you hit on 2 really important points there. And I'll go back to the first one. Like, yeah, you could be absolutely anywhere and getting these phone calls, or maybe you pull up your portal. You get a notification through your portal or your email, and you have a message and you're not thinking about it. You're just opening it because you're getting today's results. So you're getting today's instructions, and then it's not the news you were hoping for. And you could be in a very public place, and everyone's going to react to news in different ways. And I think depending on what that news or what that call or portal message is, you could kind of just be in a spot that you're like, I don't really want to I don't really want to be in public right now. I really don't want to be at work right now. And that can be really hard. I think one of the things I always, would tell people, clients, patients, or just even in the clinic that would ask like, hey, when can I get this result? Or when should I expect that phone call? Or when should I expect that portal message? And, we're not 100% sure of when that's going to come through, but, we kind of give an estimate. And then you kind of think about, okay, where am I going to be at that time? Mm-hmm. If you're thinking about your day, am I going to be at work? Do I have this I have to go to? Am I going to be at a lunch or an event or whatever the case may be? And how do I want to receive those results? Do I want a phone call? Do I want a portal message so I can open that portal when I'm with my significant other and we can open it together? So I think one of the sort of like pro tips that I think Laura and I can share, again, it's not going to make it easier to potentially get results you don't want or instructions you don't want or news you don't want. But I think one of the things you can do is be proactive with your clinic and just say, hey, when can I expect these results? Okay, here's where I'm going to be. Can I get that a little bit later? Could I get that phone call at this time? Could I get it? Hey, you're going to call me. Can I get it in a portal message instead? So I can open that when I am in a spot that I feel comfortable opening that. And again, we don't know sometimes if it's good or bad news, but either way, sometimes you just want to be in a private space when you get that phone call, when you get that portal message. So I think it's perfectly okay to say to your clinic, and we would empower you all to just say, hey, can I get it at this time? I'm going to be in a better spot. Or can I get it via a phone call or portal message, whatever your preference is. So you can take next steps or at least be in an environment that you feel safe getting getting results, and you can kind of go from there.
Yeah. One strategy, or not strategy necessarily, but one thing I used to do with patients in the clinic is I would have patients ask me, can you call me? I won't pick up. Can you leave it in a voicemail? Yep. And then when I get home or I'm with my significant other, I can listen to the message.
Yeah.
So I think that's a good strategy. I think, and I think about this, like, particularly as it relates to that pregnancy test result after an IVF cycle or an IUI or what have you. I also tell people that maybe you want to take a pregnancy test the morning that you're going in for that lab work. And so that you already have those results kind of ahead of getting the official results from the clinic. Mm-hmm. So I get that question a lot of when should I take a pregnancy test post-transfer? Not 2 days after the transfer or not a few days after the IUI. And there's like a whole lot of reasons for that one.
Yeah.
But I think it's fair, like the morning that you're going to be going in for blood work to confirm if you are pregnant, a pregnancy test should be accurate at that point. So you could always take the test in the morning, know that result. And it could be, right, maybe you want that moment that we all picture of like taking the pregnancy test and seeing a positive. And certainly, hopefully that's what happens.
Yeah.
But that way you're kind of prepared ahead of time too, I think can lessen the blow if it is negative. When you get that call, you've had time to process, prepare maybe some questions that you want to follow up with for the nurse or the doctor, whoever's calling you.
Yeah. And I'll take that in another step too. Sometimes I don't love telling people personally to take it before, because then you're already going into that blood draw. Either like, I don't know. Some people don't love, like, I already have the result. Why am I even doing this blood draw? If it is negative, like, why am I even going in and doing this? And then they're questioning like, oh, this is such a waste of my time.
Sure. That's fair.
So sometimes what I'll tell people to do if they want to take that pregnancy test, and I love having that moment. I think fertility treatment sometimes steals those moments that, we see and that we want to experience. I'll say, go do your blood draw, because it's usually in the morning, right? It's with morning monitoring. So it's early in the morning. Then go home and take that pregnancy test if you want to take it. You've already had your blood work done. You're not, you still kind of have that moment of like, we don't know. And then potentially, so I'll flip it a little bit sometimes. Like, if you want to take the pregnancy test, that's kind of I don't know, just because that if you do get a negative, that blood draw just kind of seems like, why am I doing this? We still need it. We still need to see that quantitative level. But it still can be kind of just like, want.
That's a really great point, actually. I like that strategy of take it after you've already had the blood draw. Because
Yeah.
like you said, it is important that we still have those results. You know, sometimes beta HCG levels can be really low, or
Yep.
they could be tracking abnormally, which
Yeah.
could be an indication of something like an ectopic or a biochemical pregnancy. And so we do need to monitor that closely. But that's a really good point. I've never thought about it that way, but I'm going to start using that.
Steal it
People
away.
that I'm working with.
I think another one of the things too, that a lot of our clients deal with is the absence of an update or the absence of a call or portal. And what I mean by that is we in the clinic know that no call, or if we're not reaching out, no news is good news, right? We kind of say that sometimes in the fertility community when we're thawing your embryo for a transfer. Usually we don't call you and say, your embryo's thawed, great, still come on in.
Right.
No, we're just going to thaw your embryo and then you're going to come in. If it doesn't thaw or doesn't make that thaw, then we're going to reach out to you, right?
Yeah.
I think sometimes even the absence of that update can cause stress too, if we're not setting that expectation for patients. Embryo thaw is a big one. I think during IVF and you're waiting for those blastocyst results, because it can, it can reach blast on day 5, day 6, day 7. Every clinic's different when they update you, right? So I've had some clinics, they update you every single day. Day 5, you're getting an update. Day 6, you're getting an update. Day 7, you're getting an update. Some clinics won't update you until day 7. But then if they don't tell you that and day 5 rolls around and you don't have a result or you don't have an update, you assume the worst. I know I would, right?
Yeah.
Just as humans, we're assuming it's not good news.
Absolutely.
So I think that's another great call out as far as like expectation settings of getting these results and news and those things, is asking your clinic, if they're not proactively telling you, asking your clinic, when should I expect to get those results? Like, are you going to tell me if my embryo thaws, or should I just assume no news is good news? What days are you going to call me for, or give me a portal message for my embryo results? So I know I'm getting them on this day and when to expect it. So I don't kind of spiral into thinking the worst.
Yeah. Yeah. I think another tip I think that we can impart too is scheduling, having a follow-up appointment scheduled with your physician for shortly after you're expecting any type of result, whether that's embryo results, whether that's a pregnancy test. Proactively a few weeks beforehand, scheduling an appointment for, a week after that news, so that if it's not good news, you already have time set up with your doctor to talk about what comes next versus, we've talked about this before, but clinics are so busy that you may get results that are not good. And the clinic may say, well, the next time the doctor can see you is in a month from now.
Yeah.
And that's a really long time to think about processing, right? And you can go on wait lists and hopefully you can move up. And again, every clinic is very different in the way they do their scheduling. But at least when I worked in the clinic, one thing that we would do, like when somebody started their IVF cycle, is we would say, okay, schedule an appointment for, 4 weeks out from now with your doctor so that it's on the schedule.
Yeah, no, I think that's a great call out. I think some clinics do that very well. And I think some clinics that could be done better. And, it shouldn't be on our patients to have to think about that and ask about it. But I think that's a really great call out. Just go ahead and say, okay, when is my next check-in point with my provider? And that sort of helps with any result, whether it's good or bad. You automatically have that call set up. You know when you're talking with that person. You have a timeline. I think that's one of the things when we get bad news or we get a call or result that we don't want or weren't expecting or desiring. Like I think a lot of our, and you can correct me if I'm wrong, Laura, but usually it's like, okay, what, like our clients, our patients are like, or what's next?
Yeah.
Like they really want to know, okay, well, why? They want to kind of know the why. Do we know the why? Do we know what we can change or do differently, or what happened? But they want answers, and then they want like, okay, what are we doing? What are we doing differently? What are we doing next? What have we learned from that experience? And so I think having that call proactively scheduled, you know when you're touching base, you know when the next time you're going to get to have that conversation, and it gives you a little bit of time to prepare, right?
Mm-hmm.
So you can sort of sit back and process whatever result you got, good or bad, and you can sit down and say, okay, here's the questions we have.
Yeah.
Write them down before you meet with the provider, because we all forget our questions. They're fast appointments. They're not very long. You only get so much time. So write down your questions, have them ready. But hopefully that it's given you some time to prepare, process, and then you go into that appointment really prepared to get the answers that you're looking for and those next steps.
Yeah, definitely. I think the writing down your questions, and it doesn't just pertain to this episode and this discussion, but I can't emphasize enough how important it is to write down any and every question that you have. You know, if you can, get like a journal that is dedicated to your fertility journey and keep a list of questions before you go in for appointments. And then even after those appointments, what questions are coming up for you so that you can make sure to ask them the following time that you're going in. You know, and I guess like kind of a question, and I don't think there's an answer for this, but an opinion that I have is that news that's bad, right? Negative pregnancy test, especially no embryos made, or canceled IVF cycle. I would love if those calls were always coming from the physicians, right? Because that's a highly vulnerable time for individuals. And I don't know what the solution is, but I would say in our experience, and at least in my experience, the majority of the time it is not the physician making those calls. And patients, I think, would benefit greatly from hearing directly from their doctor, especially in the event of a canceled IVF cycle. I think I think it's really easy to doom and gloom, right? If an IVF cycle gets canceled. And what I always say about canceled IVF cycles is it's usually just a matter of, we didn't get the protocol right. We didn't get it right the first time. We need to make a change. And we now have more data to make a different decision for the next go around. So it doesn't necessarily mean that like, oh my gosh, I have a canceled IVF cycle. Like that's it. It's not going to work for me. You know, we prescribe protocols based on somebody's results at a high level, their AMH level, their antral follicle count, their hormone levels, but bodies do what they want to do. And so even with the best educated guess for how someone maybe will respond, we may need to change it up, and that's okay. Now we have more data.
And people deserve to talk to their doctors during those moments, right? Like, I don't think we get a chance to talk with our providers enough. And, you know, we've kind of alluded to that in previous conversations of the reasons why behind that. Where I worked, the clinicians or the providers did actually a pretty good job of being the ones to call with the bad results. I wouldn't say it happened every time. And I think it was definitely dependent on what the conversation was. But our providers actually did a pretty decent job of wanting to be the one to make those phone calls for obvious reasons. But I agree with you, you know, now stepping back away from that specific clinic and having worked with people all over the country at a variety of different clinics, that's not the norm.
Yeah, it's not the norm. And I also think it's just because I think we know that it's probably not possible in a lot of clinic settings for that to be the case. It also just emphasizes conversations that we've had in the past about why primary nursing is so important and why it's so important for that nurse-patient relationship, because then it feels, I would say it's like the next best thing, right?
Yeah, it's like an extension of your doctor.
Right. And you're getting that call from the person that has been with you through it all and has been the one communicating with you. And so it feels like less of a blow than if you're getting a call from the nurse who's the one making phone calls that day. Right. And I think from a nurse perspective too, like it's hard to deliver that news. It's, you know, I think we sometimes forget to call out like, and I know being on the patient side, how painful it is, but I can tell you from the nurse side too, and you know this, it's really hard to give those results to people. We feel that, I think as nurses, like we take on a lot of that emotional pain and sadness that comes with one of our patients getting a negative test result or having to cancel an IVF cycle. And I don't think that's spoken about enough, just like the emotional impact that this field has on nurses.
Yeah, absolutely. Or even providers, right? Like, if they're unfortunately having to call 20 patients that day with a variety of different information and results, but the majority of that's negative, man, that is draining to have a conversation, a solid conversation with each of those individuals, and they're calling multiple people and potentially it's negative after negative after negative. Like that takes a toll on who's ever having, those conversations. So yeah, I agree with you. I don't think it's talked about enough. We can speak from a nursing perspective, but we are absolutely in your corner. We're refreshing the results on those betas, just you would be at home waiting for those results. We are, keeping our fingers and toes crossed for that embryo to thaw or those embryo results to come in and to get a good attrition. And we're right there with you. And we are so excited when we see positive results and good outcomes, and we're celebrating right along with you. But in the same token, we're grieving with you too, because our goals are your goals. And it's absolutely, it's hard. And I think too, some people are better at delivering those results than others. I don't think that's something that, we get taught directly in nursing school, or even if you're working in a hospital, or you're usually not, like, nurses usually aren't the ones in certain settings to give bad news or bad results or negative outcomes or things like that. I think fertility is one of those very unique spaces where we do have those conversations, but it may not be the most in tune thing for us to have and make those calls. So I think sometimes too, I don't know if you've seen this, working with clients, but sometimes nurses aren't the best people at that. And sometimes they don't relay things great or don't give information the right way. And, that only makes hard news harder. So I think having the right person to deliver that, and ideally that's a provider. Second best is a nurse that you've worked very closely with during your journey. But if it is someone you've never really spoken to, maybe they didn't deliver things correctly, I would just say, that's hard. It's not ideal, but also potentially give that person a little bit of grace. Maybe they've had multiple conversations that day that were hard. Maybe they're just not the best person at delivering those results. They're just not good at it. Maybe they haven't had that type of, training or whatever. But again, all this doesn't make it any easier, or not trying to
make excuses.
Yeah, exactly. Thank you. But it is the reality. I think, Laura and I talked on a previous episode about, shortage of nurses and how in this field, and how it takes time to train nurses within this field. It takes a long time. So unfortunately you may get that in between, that isn't ideal. It's not perfect, but it may be kind of what that clinic's dealing with. And so unfortunately that's how your news gets shared.
Yeah. Well, and I think sometimes it may come across cold and unmeaning. And I think that speaks to, right, again, if the nurses are making multiple phone calls in one day. I've heard stories from clients that I've worked with where they're like, I got the result and I was just told, like, we'll try again with your next period. And that can feel very dismissive in a moment where, it feels like a huge loss. Here you went through an IVF cycle. We'll just use this as an example. You went through an IVF cycle, you did an embryo transfer, and the results were negative. And I think as a patient, your automatic gut reaction is, what did I do that caused this to fail? Or what can we do differently next time? On the clinical side, right, we tend to know that a lot of times that, especially if embryos are PGT tested, embryogenetically tested, we know that there's normal chromosomes. Sometimes embryo transfers fail and there's really no cause. There's no rhyme or reason. I heard a physician the other day, is actually on my Instagram feed, and it was a physician talking about how an embryo transfer is sort of like, he equated it to baseball and players that are really good at hitting home runs, but they don't hit a home run every time. I think that that's I think that's a really good analogy, right? Everything
Yeah.
could be perfect uterine environment, perfect embryo, but it's still, the odds of success are somewhere between 60 and 70% of implantation per embryo if it's
Yeah.
genetically normal. And so I think as clinicians, right, nurses, physicians, we see a failed transfer and it's devastating, but in our minds, we're like, okay, we got more embryos, we're going to try again, assuming that somebody has more embryos. But to a patient, I think it feels very different.
Yeah.
And so I just want to call that out. I think for nurses and patients, like if you are a nurse delivering that news, to keep in mind that our patients may not realize that this is normal. And even if they do realize that this is a normal, not uncommon outcome, it's still really devastating after months of work to get to that point and have it not.
Yeah. No, absolutely. And everybody's going to deal with news differently, right? I think, and there's no right or wrong. Some people might need some more time to think through things and grieve, whatever that news was. Some people want they want to talk right away. What are next steps? Let's get into it. And there are some people that are going to want that positive nurse, or, what sounds like positive, like, hey, we'll get this next time. Here's what the doctor's going to do or whatever. They want that more optimistic conversation, because everybody's going to deal with things differently, right? I think that's one of the benefits of having a nurse or working with a nurse that knows you, is they've already had potentially conversations with you and they kind of sort of know how you lead or what is helpful for you as a person. Because everybody's going to deal with things very differently. So I think that's another thing too, that is hard when we're not in a direct nurse to nurse or nurse to patient ratio sort of situation, which many aren't, is we are making those calls. Maybe we've only spoken with that person once or twice. And, we're kind of just trying to relay the news the best we can. But we don't know how that patient's going to react. Right. And as for you as a patient, there's no right or wrong way to react to that news. And it is okay to say to whoever's calling you, like, I need a second. I don't want to talk about next steps right now. Or maybe someone says something about like, oh, you still have embryos left and, we're going to gear you up for another transfer cycle or whatever. And it's okay to say to that person, you know what, I'm just not ready to have that conversation right now. I really, that's not helpful to me in this moment. You're not being rude. You're not being mean.
Not at all.
You can say it in a very professional, respectful way of like, that is not helping me in this moment. I need some time. Can I schedule a call with my doctor? Or, hey, I already have this call scheduled next week with my doctor because I proactively scheduled it. I'm going to take some time to take on this information and, I'll reach out if any questions. Otherwise I'll talk to my doctor then. I think a lot of times patients, or at least people that I've worked with, they don't speak up for themselves enough when, what do they need in that moment? And if somebody is being overly positive or even overly negative or talking about next steps when you're not ready to talk about, like, hey, I need a day before we start going into another cycle, or, hey, it's getting into summertime. We've been talking about potentially taking a break for a little bit and going through all of this. I need to talk with my significant other and we'll get back to you. Right. Yeah. It's okay to say, can we pause? And I'll reach out, or this is what I feel next steps. And then I think in the same token, as nurses, if we can give nurses a tip out there, sometimes I think you deliver information and then maybe it's asking, what would be helpful for you in this moment? Do you want to talk about next steps? Do you want to just take a minute and we can schedule a call whenever to kind of go over, ask the patient, right? Like, what do you need in this moment? What is going to be most helpful to you? Because some people want to rush right in and go into next steps. And some people are like, you know what? I need a breath. So I think it goes both ways. I think patients feel empowered. Nurses aren't going to take it, especially if you say it in a very professional and a very respectful way. Like, this is not helping me. This was what would help me. So I think, empowering patients to do that and feel comfortable doing that. But I think empowering nurses to maybe have those conversations be different. You don't immediately have to go into next steps. We don't immediately have to go into something positive, or you have other embryos, or, you know, whatever that nurse's go-to is when you're delivering that type of news. Take a step back. Like, what does that person need in the moment, and ask them. Don't assume.
Yeah, no, I love that. I think that's a really good call out. You know, when I'm working with people, that's often what I do is I ask, what would be helpful for you? Do you, you know, if you need time to just process, go process. I'm here when you're ready. Or if you just want to vent and be a sounding board and you don't want me to like even respond with anything, or if you want to ask me questions. I think we all process that grief a little bit differently. And by no means are Ashlee and I using this platform to try to call out and be like, oh, you should absolutely work with a fertility coach. But you know, I think that is one of the benefits of having, we've talked about before, building this village around you. You know, who is that person that when you get that bad news, like, have a plan for how you're going to process that information, whether that's with your spouse, whether that's also working with a fertility coach, whether that's, you know, I'm going to go sign myself up for a massage, right? And just take a moment to get a breath, or have an appointment with if you're working with a psychologist, right? Like, having those things already in place, knowing that news can be good or it could be bad, and how you're going to process it. And I do think that, again, the services that you and I tend to provide for people are just that. It's giving them the opportunity to ask the questions if they have them, knowing that we don't have all the exact answers, but we can speak from our clinical experience and say, look, you know, I've seen, you know, I always tell people I've seen thousands of IVF cycles, right? And here's what I would anticipate, or here's questions that you may want to ask, or here are tests that you may want to ask your doctor about as next steps. Or maybe you read about something online, right? And you want to ask about that. I think that can be really helpful in processing negative results.
Yeah. And let's be real, receiving negative results of any kind, I don't think people outside the fertility community fully understand just how emotional a fertility journey is. Like, someone else looking from the outside in, again, like normal healthcare, it's not like fertility. Fertility is very different. And there's so much time and energy and money and your body and hormones and logistics and you name it going into a fertility journey. And then to get a devastating call, give yourself time it is grief. It is a loss. It doesn't look like that to the rest of the world. It doesn't, you know, that's not going to be what you pull up in a dictionary of whatever, like I don't even really know how I'm trying to say this, but just like, it's okay to, like, yes, that's a loss. That's a loss of that cycle. That's a loss of that, what it feels like sometimes, of that time. People feel like, was that a waste of time? Was that, you know, like, then your head starts spiraling, right? It's okay to take that time and to grieve it like it is a loss, because it is a loss to you. Whatever that, you know, whatever that is. It doesn't have to be a loss in what we put out there as, you know, loss at, you know, it might be, but it is for you. Wherever you are in your journey, that is a moment of, dang it. and it's okay to, like, people grieve loss very differently. Sometimes it's anger. Sometimes it's time. Sometimes it's emotional and crying and all that kind of stuff. Sometimes it's separating yourself from other people. Like, everybody's going to deal with it differently. So I love what you said of, you know, because everyone's going to deal with it differently, set up whatever works for you in advance of those results, right? Like, find that, who's your people? Therapist, a coach, your significant other, your best friend, whoever your little community is, set them up of, like, here's what I'm going to need, you know, in those certain situations, but it's okay. However your response is, it's normal.
Yeah. And I think it sounds right now like we're talking just about pregnancy tests, but I think we can say loss, like you said, loss of time from a canceled IVF cycle. And working.
That's what I was trying to say.
Yeah, no, I think we hear loss, and I think to clarifying, I think a lot of times we automatically think negative pregnancy tests. And I think those are truly some of the worst calls to receive and for us to deliver. But I also, like, right now I'm working with someone and she ovulated through her birth control prior to starting an IVF cycle. And she is just devastated, which is understandable. Here she's been preparing to get started and she ovulated through her birth control. And now we have to wait for a period. And on top of that, her clinic is saying, well, with your period, we'll put you back on birth control.
Yeah.
So she's going through this spiral of, well, isn't the same thing just going to repeat itself?
Yeah.
Right. So that can be very anxiety provoking. And, you know, we've had conversations or clinics pretty firm on, like, we're just going to start birth control again. But how do you keep your sanity during that time of being on birth control again? She's got her period and not worrying, you know, for those couple of weeks that the same thing's going to just happen again.
Yeah.
I think that could be, you know, again, having people to process. I think remembering that whatever feelings you're having, she expressed to me today, she's like, I'm angry, I'm discouraged. Those are valid.
Yeah.
Like, all of these feelings are valid. I think sometimes we feel bad about the way that we feel about something.
Yeah.
I don't know if you hear, I hear it all the time from people. I'm so sorry I'm asking this question again, or, you know, I'm so sorry I keep bringing this up, but you know, don't be sorry. Everything you're feeling is incredibly valid in that moment. So
I think we're almost force taught in healthcare that we feel like a burden when we reach out, right? Like, I think this is anywhere, not just in fertility, but, you know, it's there in the fertility space too, where we need a little bit more of that education, hand-holding support. But really anywhere, it's like you reach out and you're not getting a response for days, hours, days, depending on the situation.
When I can't remember,
you're calling insurance companies and they're annoyed. You're calling pharmacies and they're annoyed that you're calling about this. You know what I mean? Like, I think we feel like we're a burden if we're asking our questions and we're reaching out. And I think especially in any moment, that shouldn't be the case, but I think especially in moments of a devastating news or call or canceled cycles or whatever the case may be, I mean, that's definitely a moment where you should not feel like a burden. You should never. But
when I don't know if we've talked about this before on the podcast, but for those of you who don't know, like, a diagnosis of infertility or going through fertility treatment, the emotions experienced are very similar, if not equivalent, to a diagnosis of cancer.
Yeah.
Those feelings are very similar. And one statistic, again, I don't know if I've called this out on the podcast, but, like, the number one reason that people drop out of treatment is from the emotional aspect of it.
Yeah.
And I think that's really telling to just how traumatic this process is for a lot of people, and how valid it is that it is traumatic for a lot of people. So I want to make sure we call that out, because I think, and especially for maybe someone who's listening, who's supporting someone going through infertility, like, if you think about both of those statements I just said, those are really powerful.
Yeah.
You know, just putting yourself in that position, it's extremely difficult to get a diagnosis of infertility and to have to go through any sort of fertility treatment.
Yeah. And I think you bring up first of all, it's extremely powerful, but I think you bring up a really good point. If anyone's listening that is supporting someone and you're listening to this podcast wanting to learn a little bit more yourself of the process and the real and the unfiltered version. And I think that's a really important that you kind of like what Laura and I were talking about, giving people space and asking them what they need.
Yeah.
Or what do you need in this moment? And I think that goes for people supporting, whether that's a significant other, a friend, a family member. It's not asking, oh, are you going to try again? Or, oh, you have more embryos, so it's fine. Or, oh, at least you know you can get pregnant if it was a, loss after a positive pregnancy. You know what I mean? Like, there's so many things people say and they don't mean it in a bad way, but it comes across just terrible, especially after you've gotten negative news of any kind. So I think that's a really important call out for anybody that knows someone or you're supporting someone that is going through any type of fertility journey, sometimes the best way you can support them is, what can I help you with?
Yeah.
Or not even asking that, because sometimes we make decisions all day long, especially in the fertility. The decision fatigue in the fertility space is just overwhelming, deciding all the time what to do here and what to do here and what to do here. And it's a lot. So I think sometimes even like, hey, what can I do to help you? How can I support you? Sometimes it's just, do not respond. I'm here. I was just thinking about you. I wanted you to know that I was thinking about you. Feel free to respond if I can do anything to support you. Otherwise, just know you have someone in your corner right now. I know you were getting these results today. I know this was happening today. Don't even have to tell me what it was. Just know I'm here if you need something. And sometimes that is just the biggest, like, just exhale of like, I don't have to respond to this. If I got positive news or I want to share, I can, or I can absolutely just ignore it and just know that there's people in my corner. So I think helping support people understand what somebody needs can be really beneficial too, especially in the event of devastating calls, canceled cycles, things like that.
Yeah, this is a really great point that we're talking about, is from the support person perspective. Especially, I see a lot of like parents of children that are going through infertility, and I see a lot of projected anxiety from the parent onto the son or daughter who's going through the process. And I get it, right? You are worried about your child, and you're worried about, their emotional stage, and you want to support them. But what I have found, and this is a conversation that I have a lot with clients or patients that I've worked with, is sometimes you need to set boundaries of, it can be really overwhelming when you're going through treatment and then you have a significant other or a parent asking you, well, what does that mean? Right.
Yeah.
So it's like you're constantly having to re-explain to somebody else what it is that you're going through. I think that can be really hard. It almost like and I think it places guilt sometimes on the person if they do have a failed pregnancy test. You almost feel like you failed yourself, you failed your significant other, now you failed your family. It becomes a lot of pressure. So I think for patients, number one, it's okay to set boundaries. I've had people just outright choose not to tell family members when they're going through it, and that may be the right decision for you, and that's absolutely okay. But I also think from a parent or a support person of somebody going through infertility, like, I think exactly what you said, Ashlee, of instead of asking people what they need, just letting that person know that you're there. And you may be having your own anxiety inside of what's happening for that person because you love them. But then I think it's important for that support person to also like get support from a therapist or, again, a coach. I've had family members say to me before, I love what you do. I love what you're doing for my daughter. I wish there was stuff like out there for me like that. And I think that's a really important call out.
Yeah, no, I love that. I think supporting the support person, right? I think I hear this a lot from the significant others more often than not, of like, how do I better support my partner going through this? Because a lot of times it is more time consuming. It's more physically demanding on the person that is more like navigating, actually going through the treatment, things like that. And I think it's super important and empowering for the support person, the significant other, the partner, whoever, to just ask those questions. How and not only potentially reach out to external resources, but communicate with your partner, right?
Yeah.
I feel like the lack of communication sometimes in fertility care, like we don't even talk about it enough amongst ourselves, because it already might be a strain on our relationship. It already, like, they're hard conversations to have sometimes, and we're living life. Life doesn't stop. So the burdens of life and stress of life are already out there. But then to throw on a fertility journey, potentially negative news, I don't think we talk to each other. I think that lack of communication is just not there. Like, how can I support you the best during this process? What sort of cadence of communication could we have to just make sure we're staying on the same page during this process?
Yeah.
And then the support partner just asking that person, how can I help you in this moment? Or what do you need from me today when we get these results? Or how do you want to navigate this? Just having that direct support from somebody you're actually going through this with, or, navigating that family building together, I think is super important and not talked about enough. And unfortunately, we hear more often than not is, that maybe the support partner is not helping as much as the patient would like. Right. And that's the unfortunate reality sometimes of this journey.
I think sometimes that comes from a lack of the partner not knowing how to support their partner.
100%.
And I think some of it, right, there's all kinds of different relationships. If we're talking strictly a heterosexual relationship, I think men, right, like they process grief very differently. And I think men are often very forgotten about when it comes to fertility, because we're so focused on like what she's doing and the injection she's taking and, the amount of times that she's going into the clinic. And men have like this one job, right? Their one job is to like give sperm on the day of an IUI or IVF or, have sex on demand, which can be really stressful.
Yeah.
So there's a lot of strain on relationships. And I've definitely been in the middle of some of those strains. Like when I think about back to nurse consult days where we would be preparing someone for IVF and we'd be signing consents and tough questions would come up. And I'm like, I'm going to leave the room. I'm going to like,
yes. I
think it's an important call out there though. I think sometimes we see it as a failure if we need to ask for help.
Yeah.
But I do think like, again, couples therapy during this time of, during this time of our lives can be really helpful in learning to communicate with each other. And as women, right, we're really good at expecting that our partners are going to know exactly like what we need from them.
We love to just assume they just know what we need
all the time.
They're just supposed to know.
They're just supposed to know. Right. And I don't think that we're good at communicating. We're expecting, and then when they're not living up to those expectations, it creates animosity and it creates anger. So I think, it could be really helpful. Again, a fertility coach, a fertility psychologist, like having people around you to support that relationship is extremely important.
And I think this brings to mind something, again, that we don't talk about enough. But especially like when somebody gets devastating news, a negative pregnancy test, a canceled cycle, whatever, all this encompassed together. I think some of the time, I'm kind of getting off track from what we were just talking about a little bit, but in the clinic, I think sometimes we forget people have had this entire journey before they've even gotten to the clinic.
Right.
They've been potentially trying for years and years, and a negative pregnancy test can be their 20th, 30th negative pregnancy test.
Yeah.
It could be not their first loss, unfortunately. It could, maybe they're coming from another fertility clinic and they had a terrible time and they had a canceled cycle for whatever reason. I think sometimes we see just a snapshot of somebody's journey when we're working with them in a clinic setting, because we only get to talk to them so many times. We don't get to know them as, personally, but they've had this entire journey before they have been in front of you as a clinician. Right. And so I don't think that gets talked about enough in the clinic setting of somebody's journey that even happened before their, what we say, fertility journey, right? Like when you're at the fertility clinic and you're going through treatment. And I think that can exacerbate sometimes getting those results and having those emotions and that feeling of anger or disappointment or blaming ourselves or, whatever the case may be. I think it should be validating for that person and experiencing that, but we also don't know where that person's really coming from.
Yeah.
We don't get to know our patients like we should or wish we all had time to do. Right. And so I think that can be something that we just don't talk about enough, that the journey is not just this, okay, 3 months to get ready for this cycle. And unfortunately it's canceled. Oh, well, it's just been 3 months. No, it hasn't.
Yeah. Right.
No, it hasn't. It could have been years leading up to this point.
Right. And I think the expectation is often that, okay, I've been struggling on my own. It hasn't worked. Of course, when I do fertility treatment or if I do IVF, like it's absolutely going to be successful.
Yeah.
I will say, I think some of this comes down to really poor expectation setting by physicians and nurses in the clinic, unfortunately. I think sometimes, again, we've had conversations. There's good doctors, there's bad doctors, but I've seen clinics inadequately prepare their patients for what an outcome might look like, right?
Yeah.
And I've seen a significant lack of education around like what is ovarian reserve, like what is my AMH level and what does that mean for my chances of success?
Yeah.
How does my age impact my chance of success? These are tough things to talk about. And it's a very sensitive topic, I think, especially as women, to talk about how age impacts treatment outcomes.
Yeah.
But I think sometimes clinics and physicians and nurses, we avoid having those tough conversations. But I think the fall is so much harder again when you this expectation of, well, of course it's IVF. Doesn't matter that I'm 44 years old and like it's IVF, so it's going to work. And knowing that it could work, but there's a good probability it might not work either.
Yeah.
Right. So I think expectation setting, I think it's incumbent on patients. Again, this goes back to our ask questions. I can't tell you the amount of times that I've gotten on the phone with someone and I've, getting to know a client for the first time. And I say like, so do you know what your AMH level? And they're like, what's that? And I'm like, this is really important information for you to know. An informed patient is an empowered patient.
100%.
And unfortunately, I think this is an area where clinics are really falling short.
Yeah. No, I 100% agree. And I think that's ultimately why you and I started this podcast, but why we wanted to start it, why we named it, why we have certain conversations that are just not fun to have. And they might not be your typical podcast topics and things people want to bring up. But I think one of the things that Laura and I are both very passionate about is setting expectations, whether that's through education, whether that's emotional resilience, whether that's making decisions, you name it, we're going to give it all. We're going to tell you the good, the bad, the ugly, because it's not to be negative. It's not to bring down the conversation. It's just to set real expectations. It's really to talk about the reality of fertility care and the reality of many people navigating this process. And I think it's super important to normalize these conversations, to normalize people's reaction to them, to normalize support in the community because of all of these things. And I'm going to use your words because I like it. And I think it fits in this, that it's not linear, right? I think we've said it on every podcast. I think we should incorporate that somehow into every single podcast because we've done it. Absolutely. It's not linear. And this is part of that. And you may never get a devastating call. You may start your cycle and you get great embryos and your first embryo transfer works. We've seen it happen.
Absolutely.
But I would say it's, more common than not that at least at some point in the journey, something's probably not going to go your way. And you didn't do anything wrong. It is not your fault. And I think if we talk about these things and normalize the conversation and talk about ways to support during those conversations or when you get those news, that can be extremely empowering to everybody navigating the process, from clinicians to support persons to the patient directly experiencing it.
Yeah, absolutely. I agree. Well, should we leave it at that for this week? And because I think we could talk about devastating results all day long. I think there's so many things that we probably didn't even hit on in this episode. And I'll just end by saying, it is normal for this process to feel like a roller coaster. There are going to be days where you're riding high and things feel really good and wow, like things are really going my way. I guarantee you, like there will be a down in some way, shape, or form. Maybe a little down and maybe a big one, but it is really normal because again, it's not linear. I don't think of fertility treatments as a straight line. It really is an up and a down. And so if you're going through it, just know that what you're experiencing is very normal. Build your support community around yourself. And, you know, again, reach out to Ashlee and I through the podcast. We want to hear from you. We want feedback on these conversations. So please like, DM, subscribe, email us, however you want to get a hold of us, we're here for it. So
we'd love to hear from you. We'd love to have you share your stories if you have any, or want to have a conversation more about this. Or if you just want to tell us, you know, that we said something incorrectly, we're totally open to that as well. We want to hear from you. We want these conversations to really resonate and be empowering to everybody in the fertility community, because I think they're important to have. So
absolutely. Awesome. Well, we'll see you
next time. Bye.
If this conversation resonated, like, comment, or subscribe, share, send us your questions. Nothing is off limits.
And wherever you are in your journey, know this: you deserve support that's real and human. Never forget to ask your questions, advocate louder, and remember, you're not crazy. Fertility is hard.
That's it for today's episode of Fertility Nurses Unfiltered. Thanks for spending your time with us today.
We'll see you next time.